Very good morning, Shri Prakash Bhai Patel sir, Dr. J.R. Patel sir, Dr. J.K. Patel sir, Dean Newton College of Physiotherapy, Dr. Subhash Khatri sir, faculties, and my dear friends. Thank you very much, Newton College of Physiotherapy, for giving me this honor and opportunity to speak on pedagogical practice in physiotherapy. And I must congratulate Dr. Subhash Khatri sir for bringing this topic because it is very much need of an hour. So I will be speaking on pedagogical practice in physiotherapy. Now, what is pedagogy or what is pedagogy? That I will be speaking on. What is the significance of pedagogy in physiotherapy? I will be talking on a very interesting Howard Gardens of multiple intelligence. And also I would like to give some suggestions to improve teaching methods for the improvement of students' understanding of physiotherapy subjects. So what is pedagogy? It can be defined as art of teaching. It involves being able to convey knowledge and skills in ways that students can understand and remember and apply. Pedagogical skills can generally be divided into classroom management skills and content related skills. Now, there are many definitions of pedagogy. It can be defined as a theory, methods, and philosophy of teaching. It can be defined as a methods and practice of teaching. It can be defined as a study of teaching methods. And it can also be defined as the art and science of teaching methods. Basically, it is a Greek word, pedagogos. It means leader of children. Basically, this word came for it was meant for teaching methodology for school children. So the significance of this pedagogy is a well thought of pedagogy, that is teaching methodology, can improve quality of teaching methods, which can help the students in getting better, deeper grasp of subject. Now this Howard Earl Gardner, he gave a theory of multiple intelligence, very interesting and so true, that he proposed that theory of multiple intelligence in 1983. He said that people are not born with all intelligence they will have, as there is a traditional notion that there is only one type of intelligence called general intelligence. But actually there are 4 types of intelligence: visuospatial, linguistic verbal, interpersonal, intrapersonal, logical, mathematical, musical, bodily kinesthetic, and naturalistic. So looking at this intelligence, because it is very important to know how many types of intelligence are there among students, and keeping those things in mind, we have to start teaching. So once we know what kind of intelligence are there, different types, accordingly the educator will choose the teaching methodology. So in India, the situation is unfortunately a pedagogical background or a knowledge is not a prerequisite for teaching physiotherapy in India. And most of the lecturers teach because they have a special interest in subject or they are good with particular aspect of physiotherapy. So physiotherapy educators, they have to research their practice to ensure quality and acceptable standards. Also, there is a rise in teachers' workload of other than teaching. So that gives less time to focus on teaching methodology. So basically the perspective should include in pedagogy, skill and knowledge, learning approaches, and clinical experience. The aim of pedagogy in physiotherapy is to cultivate excellent practice into the teaching and learning of physiotherapy students in the classroom setting as well as clinical setting. Now I have few suggestions. The selection criteria of teachers should be on the basis of qualifications as well as teaching experience. The selection criteria for the faculties or a teacher in physiotherapy cannot be on the basis of their academic mark sheet. In the sense, if the student is good in the mark sheet, doesn't mean that the student is good as a teacher. So that should not be the only criteria when the teachers are being selected. And teachers training program should be mandatory. I strongly believe it should be made mandatory for all faculties before joining academics. And administrative workload should reduce so that teachers can focus on subject more. Every 5 years, there has to have an update exam certificate for all faculties till he or she retires. And students' feedback of teachers should be mandatory so that in next time teachers can improve their teaching style looking at the students' feedback. Practical or clinical topic should be mandatory with the actual either of patient or it should be taught by simulation so that either students can feel that thing or student can see it. So it will be easy for student to remember and it will be easy for student to understand. And students should be provided good infrastructure and excellent learning environment. So these were my suggestions. And as I said, the teachers training program should be made mandatory because it gives emphasis on teaching methodology. I have done it, so I know it should be mandatory. How to make teaching more effective for students to understand the subject, that is also included in teachers training program. How to draw question papers. What should be included, what should not be included in drawing question paper, that is what is taught in teachers training program. How to make examination theory as well as practical effective, and how the teacher should remain updated. All this thing is being very nicely taught in this teachers training program, so it should be made mandatory for all teachers. As a part of GSCPT, I being a president of Gujarat State Council for Physiotherapy, we are working on improving quality of teachers, quality of syllabus, examination system, and teaching methodology. So hopefully, we are trying to see to it that the quality of teaching and teachers improves in Gujarat about physiotherapy profession. So pedagogical aspect of physiotherapy is for better teaching skills for students and for young physios who inspire to be a good teachers. Thank you very much once again. Thank you very much, Nutan College of Physiotherapy, for giving me this excellent opportunity. Thank you very much again. Wish you all the very best.